Cure Violence is really special in that it's a data-driven approach to implementing these community violence programs in the catchment areas that need them the most. It is real people from these types of neighborhoods who understand the needs of the people. Cure Violence's approach is to detect and interrupt violence in whatever form it may be within a community. It has been such a dramatic impact. In 2021 alone, we saw a 46% reduction in gun violence. That's almost double what we saw compared to the rest of the city. So it obviously works to have this individual community-based approach in the way that Cure Violence does it. While we're very proud of the numbers and how successful they've been, I think it's the individual stories. It's being able to speak to actual human beings who have not only had their life saved in a very real sense by being removed from a violent event, but to also see that there's a commitment beyond that one-time interruption to ensure that they have a future.
The Neighborhood Healing Network is a collaboration of organizations assembled by Arches to address community residents who have been impacted by crime and violence. We were attempting as an organization and a community to figure out how we could better offer services to community residents living in marginalized communities who typically shy away from accessing victim services. We knew that if we had an opportunity to receive funding from the Missouri Department of Social Services, that we could design a program that would really engage neighborhood residents in the communities in which they live and reach them where they were. Our primary goal is to create awareness about the trauma associated with the long-term exposure to community violence, and that community residents are sometimes not aware of the trauma. In some cases, they begin to normalize the trauma and the violence, and it's not okay to live in communities where that violence is occurring on a daily basis. It's okay to say that you're struggling mentally, and it's okay to seek help and assistance. What this award means to me and my team is that Arches is truly living up to our mission, vision, and core values as it relates to creating programs and systems of care and intervention that truly meet community residents where they are, responding to real needs within the community and within the region to help our region grow and prosper.
Rung for Women is an organization that helps women move up the economic opportunity ladder. We work with women who are interested in advancing their careers or changing careers, while also removing all of the barriers that get in their way of success. We know that when women are successful, their families are successful, the community is more healthy and vibrant, and the region is stronger. Our big goal is that within 5 years, 90% of our members will earn a family-sustaining wage. So that's our big goal, but we see success every day as our members are getting promotions, as they're getting in new jobs, as they're completing training programs. So success for us comes daily, but I would say the big goal is to really move the needle on economic mobility for women. We are really excited that in just 1 year of operations, we have served more than 300 women. So I think that's having a huge impact on the region. Thank you for this award, and thank you for acknowledging the great work that we do for women.
What people, I think, should know about the task force is the unique amount of collaboration that occurred, both at the beginning of the pandemic, but that continued throughout the pandemic. So it originated with the healthcare systems, but we knew that this was going to impact a big part of the community. Because of that, people that were included also included public health, the business community, the federally qualified healthcare centers, regional health commission, our local elected officials. So really a broad swath of people that we knew were going to have to be dealing with the pandemic. We weren't sure what to expect, but we knew we would be better if we worked together on this. I mean, it's always nice to be honored for the work that you do. But one thing I always make sure I emphasize to people is, we really represent those thousands of people, whether they were in healthcare or public health or in our clinics or even just people out in the community that listened and did all the right things to help prevent spread of disease. So really, if there was a way that we could, divide the award up and give it out to each of them, that would be great. The only way that we're successful is everybody contributes. And so even though we're very honored to receive the award, I think it's really it really speaks to the dedication of the community.